How do you kind of help the patient navigate that journey to take more onus of their own health, right? And that's where our programs come in, because it helps with automation of communicating with the patient at home, making sure they do what they need to do, getting the data automatically embedded into the chart. So the doctor's like, hey, Jack, last time I saw you, your A1C level was at 6%. But guess what? Since you've been on continuous glucose monitoring, and when I see the data, and you want to do another blood test after 3 months, it's down to 5.7, right? Because that data is coming in. And then, are you a sports guy? Do you enjoy sports?
Love sports.
Why do we take score, right? Because people pay attention more. And likewise, getting data back from these devices and technology, everybody's invested now. So the patient's invested because they're like, oh, my score is not going down. Why not? And the doctor's invested, it's like, your score didn't go down. Your high blood pressure didn't go down. Why not? Oh, well, maybe I did eat some more salt than I should have. Or maybe I didn't get my 30 minutes of walking in, Okay, well, let's figure that out together, right? And so it's a journey. And then now that the doctor and patient are more alignment we talked about before, at least the doctor and patient aligned, that they both want the patient healthier. And I think that's the key too. So it does help with alignment on that level. And it helps somewhat with alignment too, because now the doctor sees reimbursement that's coming back from these programs that they're doing with their patients.
If you're running RPM, CCM, or chronic care programs, hear this. Remote care claims are the only claims in your practice where the documentation is the service. An office visit happened. A person walked in. If the note is thin, you've got a documentation problem. In remote care, if the note is thin, you've got a billing problem, and usually missed reimbursement. I'm Theo Harvey from SynsorMed. We've supported over 40,000 remote care claims since 2014. We took what we've learned and built a simple one-page remote care billing checklist. It walks you through the 3 diagnostic checks we use to spot exposed and missed revenue, scoped to your actual RPM and CCM volume. If you want to know today whether your remote care billing is tight or leaking, grab the checklist, click the link, drop your email, and get instant access to the free remote care billing checklist.